All right, so our project is the 2021-2022 Planetary Health Report Card for the University of Utah School of Medicine. The authors are listed here. So we had a number of really awesome student authors, myself and Ellenor included, and then representatives from all of the classes, including the MD PhD cohort. And our faculty advisors were Dr. Smitha, Warrier, and Alexis Lee. I have to figure out. All right, so I wanted to start with this quote first. So this is from the AAFP's official stance on climate change and health. So it says the AAFP is committed to providing strategies to help family physicians understand and recognize the impact of the environment on patient health and improve the health of patients affected by poor environmental conditions. So this is just something I was able to find on their website, so it's readily accessible. And so we know that it really matters to family physicians through the AAFP to be thinking about climate change and health. So how does this apply to our medical school? Well, we know that a large percentage of our class end up going into primary care. So the most recent class that matched, a class of 2022, 36% matched into primary care and 11 of those matched into family medicine. So a lot of the students that we're training end up going into family medicine. So a little bit about a background about the report card. First, I'll start off with this definition. So planetary health is defined as the health of human civilization and the state of the natural systems on which it depends. So this is a definition put out by the Planetary Health Alliance that first coined this phrase. And kind of a few years later, I believe that definition was put out in 2015. A few years later, a group of students out of the University of San Francisco started this Planetary Health Report Card. And it's basically a needs-based assessment for the School of Medicine to look at the sustainability efforts. So this is our second year in a row participating in this report card. The methods used for this project. So we started out with a whole ton of data collection. We talked to people all over the School of Medicine. We talked to people within health sciences. We were talking with the main campus Office of Sustainability, a bunch of stakeholders in all of the different intersecting institutions of which the School of Medicine is a part. The next step was to assign scores. So there's a bunch of different individual metrics, and each of these were divided up into 5 categories. Ellenor will talk about that a little bit later in the presentation. But basically, we took all the data that we collected, assigned scores for the individual metrics, came up with category scores, and then put that all together to come up with a final grade. And Ellenor will take over from here.
All right, so here you can see the total results. Our overall score as a University School of Medicine was a C-. Curriculum composes the largest component of the score at 30%, and the other 4 metrics, research, community outreach and advocacy, support for student initiatives, and campus sustainability, all make up 17.5%. So curriculum was a D, research was a C, community outreach was a D-, support for student initiatives was the highest grade at a B, and then campus sustainability was a D+. And we'll go into a little bit about what recommendations we made as it is a needs-based assessment. So we did make some recommendations about how to improve these scores and different changes that the School of Medicine can make to become more sustainable and more planetary health focused. So next slide. So I'll just quickly discuss the key findings. Overall, like I said earlier, the score was a C-. Curriculum, we got a D. That has a lot of opportunity for change. There's some opt-in curriculum opportunities, such as an elective course where students can choose to receive more of a sustainability focused health related education, but a more consistent education that's integrated throughout all 4 years is needed. And then research, a lot of research is being done on campus, but it is pretty widespread, and it can be difficult for students to find researchers, for researchers to find each other. And so a centralized database that integrates the health science related environmental sustainability research would be beneficial. For community, this is looking at how we as a School of Medicine engages with the community. There is some engagement at the University School of Medicine and UHealth, but work is needed to communicate with the broader community. For student support, support is available for motivated students, and there's also grants available through the main institution. However, it's actually difficult for students to find access to mentors and funding unless they're motivated and they search for it. So it would be beneficial if these opportunities were expanded and also advertised. And lastly, for sustainability of the medical school, positive changes in renewable energy have been implemented, but a more ambitious carbon neutrality goal and divestment from fossil fuels are necessary. Currently, we're at a 2050 goal, and for a full score on the report card, 2030 to 2035 is the target. So there are some changes that could be made from the School of Medicine to reach more sustainable goals. All right, next slide. All right, and the limitations of our project was that only the School of Medicine was assessed on the report card. There's a lot of different initiatives occurring in the other parts of campus that could have possibly improved the score if we looked at them. However, the report card does focus specifically on the School of Medicine, and so participation from the other health sciences colleges would strengthen the message. Schools such as nursing, pharmacy, they actually started a pilot Planetary Health Report Card program for schools of nursing and pharmacy and others this year. And so having an analysis of more than one health sciences college at the University of Utah would allow for us to have a more integrated and broader degree of suggestions and analysis. All right, and lastly, looking at our current progress and moving forward, we have presented this to the Health Sciences Executive Education Committee, and they're on board about integrating this into the curriculum. There's a green team at the hospital that's focused on sustainability. And because of our efforts in creating the report card over the past 2 years, there are now student representatives on the green team. And in order to increase our student participation and allow for more students to become exposed to this, it would be beneficial for us to work on expanding the Sustainability Club, and then, of course, continue working on this report card next year, and that allows us to look at more trends and see how the School of Medicine has changed. So that concludes our presentation on the Planetary Health Report Card. We're open to answer any questions now.